Welcome, everybody. Thank you for attending this episode of Pair Club. Today, I have the amazing Dr. Kelly Tanner, who's a PhD in organizational leadership. Dr. Tanner uses her skills to train teams in high performance leadership and digital workflows. Her ability to motivate the team to take ownership for the case acceptance builds trust and strengthens the relationship within teams. I must say, I think out of all the thousands of clinicians and hygienists that I met in this world, you're the first dual PhD RDH that I've had the pleasure of meeting.
Oh, thank you. There are a few of us and we're all doing wonderful things. And I'm happy to, for everybody to come on. Let's get this thing going. Let's, inform our process and our progress as we grow and learn and empower each other.
It's fantastic. And you're the founder of the Next Level Dental Hygiene, along with the Ascend Health Partners as well.
I sure am. Next Level Dental Hygiene, the focus of that company is to empower dental hygienists and also teams to work together to provide like an educational hub so everyone can grow, learn together, meet them at their readiness of where they are in their career. And so they're on their trajectory to where they want to grow. And Ascend, and I don't know, Darius, if I spoke much about this with you, but Ascend Health Partners, what we help companies do, not just in dentistry, but also in different areas of healthcare, is we help them establish a mindset of their team of how to incorporate new technology, processes, procedures, efficiencies. So it's more like the consulting arm of Next Level Dental Hygiene. It's me, and I have other folks on my team as well who help other organizations do that, so they're successful and they can live in their mission where they desire for their company to go and grow. But you got to have that team buy-in. That's the biggest part, is you've got to have that, because if those people aren't buying in, processes fall flat.
Growing up in my world when I was selling dental supplies for so many years, I always had so much time to think about dentistry overall. And I still stand by it. Dentistry is always 10 years behind time. So, like when new technology is being introduced into a dental atmosphere, it's like you definitely need the entire team's buy-in, because if one person doesn't know how to operate it, then it just won't jive. It won't work.
For sure. And two, even just the one person, right? It doesn't even have to be the whole team. If you have one person in the office who's a naysayer, and it can kind of bring morale down. And that's one of the things that I love to talk about is, be mindful of your words and your energy, because your words they are who you are, and they affect everyone, your family, your friends, your practice. And so getting to know how your personal impact affects everything else on the outside of you and what it is that you're doing, and how you're kind of stopping you're not growing that limited mindset, and instead of a growth mindset, and how you're staying in your own limiting beliefs for how it can truly work for you. So technology, processes, procedures, new doctors in the practice, the change in dentistry is the one thing that you can always count on, right?
Yeah.
And so if you can embrace that and be a part of it, to think about, how can this actually help us to get outside of yourself, to think about how can this truly impact the patients and our customer who we serve. If you can't unthink that or rework that in your mind, it can be a setback for the practice or the organization.
What sort of training modalities do you provide to practice owners and the professionals that work for them? Is it done like online typically, or is it a workshop live in person?
Thank you. I've done all the above. If it's for dental practices, and I'll have not even small dental practices, for nonprofits, for profits, dental practices, I'll go in. I provide disc assessment because I really firmly believe of the individual awareness, that self leadership that comes first within all of us, find who we were meant to be, and find our true north in ourselves. So the certifications that I've earned, I'm a John Maxwell certified coach for performance and executive coaching. I also offer DISC training. Many people in the industry have heard of DISC, and it's not just reporting out on your DISC. It's, what does this mean to you? What does this mean to your team? What is out of that DISC that your team members need to know? I mean, how do they come to you when you're stressed out and tell you something really important? Because that can shut you down, shut them down. So it's all the things that you can pull out of that DISC assessment. And then also, I'm certified in emotional intelligence and also driving forces. So to to empower that person on that individual level to understand them and themselves first, to then understand how they interact as a team member, and then the impact that team has on that practice, that organization, how they overcome conflict, have these courageous conversations, set the expectations of the team. So I truly go back to the individual first to understand, reverse engineer it, as everyone says, reverse engineer it, look back to see where you start from, and then say, okay, how do we plug this in moving forward to understand the individual? So I do that for teams all the time. So I do that in person. I have webinars where I do it for larger groups. And also we are formulating some things for our Next Level Dental Hygiene website now. That's going to be a bundle of courses for that self leadership for dental hygienists. And then, if I could mention it, in Bermuda, we're having our first ever Bermuda Dental Summit in September, where high performance teams is called Align Your Teams. Allison Lecusier and I are hosting this in Bermuda, and we help your team unthink, rethink what their role is in the practice, come up with these goals. And then also, I work with a lot of technology, a lot of companies who work with technology to improve patient lives and improve their outcome, their health outcomes in whatever industry that it's in. And so with this particular summit, we're focusing on not just high performance teams, but how they're bringing in 3D digital scanning with iTero, how they're impacting lives through education, through the systems that they can create so the patients can understand truly what the condition of their oral health is in a way that they've never been able to understand it before, to have the autonomy to make those decisions. So I do it in a lot of different ways, and I get special requests all the time to customize this around what the needs are of the organization. So I'm open to do any and all of it. That was a long answer to your question.
Are the courses online more adjusted based on the professional type? Like, let's say you have practice owner versus hygienist versus dental assistant.
For right now, it's going to be geared toward dental hygienists. And the way that it's intended to grow is to then, we have a whole other website that's being built out that should be released relatively soon, that will be more team facing, not only for the dental hygienist, but so look forward to that, you guys. If you want to follow all this, you can follow me on Facebook, Instagram, Next Level DH, and all of those updates will be coming to you through that, through those social ways that we do things and how we stay connected.
The hygienist audience that you cater to, does it feel as if they are more better suited for the educational platform if they're permanent type of workers or versus temp? Because I do know like a lot of hygienists prefer to temp out there and they have to kind of balance between various cultures of different businesses without enough time to settle to everything that you teach.
That's a great question. And Darius, I know that's an important one to you too, with what your interests are with placing individuals with high performance dental people within offices that is like the love connection, right? And beyond finding that love connection, I focus on finding the connection within yourself. And then truly, it's a transferable skill to basically anything. Just like you can take one skill and you can learn it. If you learn how to meditate, that doesn't just apply to you, it affects everything. If you learn how to name a skill, you can take that and you can, mindfulness and growth mindset and the way that you are in the individual setting, how your level of empathy affects those around you. I think that not only is I think it's an asset for both a person who's a guest hygienist and a person who is in a permanent position, because on either side of the track, if you're a permanent hygienist, you're gonna have to you're in a position to welcome that guest hygienist anytime too. So you've got to have that skill set to be welcoming, to say, "Hey, Susie, come in. Welcome to our team for today. We're so glad you're here." To be able to be put yourself on both sides of that. So it's a what I teach is a transferable skill to any setting. And I think it truly is a gateway to empower what it is that all of our giftings are. Because if you could say something, Darius, and you could totally think that you're coming off the right way, but it's not received in the same way that you think that you're coming off. And that's bad. That's not how you build a team.
I couldn't agree with you more. This is definitely a skill set that you teach that can be applied to their day-to-day communications in life, not just in the professional working world as well.
for sure. And many of the problems that, if you think about problems, issues that you've had in any employment situation, they're people problems, right? And people problems, usually the center of those, the gooey center is empathy and emotional intelligence. And to be able to courageously communicate with empathy in a respectful way, there is a tactful way to do that. It's not always natural for folks. So, how do they learn the skill and how to do this? But first, like the emotional intelligence assessment that I offer, one of the things that people can say, okay, not only is this a good guideline here, but what does this mean to me? How can I grow? And then where do I need to fill in those blanks too for where my score is on myself?
From a organizational leadership standpoint, how much emphasis goes upon the individual characters within that umbrella of the main leadership, the main operator, the owner doctor's practice?
I would say that at least 50% is that, if not a little bit more, because if you are not aware of how you're impacting others and you cannot regulate those emotions, it's not going to allow the team or to elevate other folks' emotions based on how you feel. You have to place a filter all day on what you're doing. And if that filter is not applied, it can come off in the wrong way and affect your team and your practice. So that individual is truly at the center of that practice in empowering that person.
Is there like a common, I guess, void that you see in what you're bringing solutions for from a day-to-day perspective with these different various practice cultures out there?
Yes. And it all boils down to communication. The way that people don't even talk about just something simple. So if you're married, if you're in a relationship, if you have a best friend and you say to them, that really ticks me off when you do that. We don't do that in practices. We don't, we do? We bottle it up. People get upset. They build resentment. And John Maxwell says that the smaller the team, even more important your level of communication. You have to raise it up to a higher, more efficient level of communication. So taking time to understand the personalities in your office, what's going to trigger them? What are your blind spots to be triggered? From an emotional communication standpoint. And then how you overcome that. So any of my friends, like one of the things that we just recently came up with in one of my companies is, sometimes your friends want to tell you something, but they don't want to hurt your feelings. Have you ever been in that situation?
Pretty often.
Okay.
I'm usually on the other end.
So instead of saying, Darius, what in the world are you thinking about? Like, really, man? Like, were you really thinking about doing that? Instead of saying that, which as a response could totally shut somebody down, right? Totally just be like, why did I feel that way? You feel ashamed, you feel hurt, you feel fearful, which could trigger all these emotions with people. Instead of that, what about if you knew how to communicate with that person? So you tell them how you feel, right? So instead of coming sort of at people and telling them what you're experiencing, I've come up with recently this little statement. It's kind of like a safe zone statement saying, okay, I'm about to say something to you that is going to be a growth opportunity for you, but I'm saying it with love. So it's like a word of agreement. Okay. So I say, I'm going to offer you a ladder to elevate you to the next level. Can I offer you a ladder? And I always ask permission before I do that. And so it's like, okay, wait, am I ready to receive that ladder? Am I in a good space? Or say, okay, I do want to hear it because sometimes you might be in a hurry and that might not be your best space to receive that, right? So you can say, you know what? I do want to hear about that ladder, but right now I have to sit down with this patient. But what you have to say is really important to me. And in that time, or it could be immediate. Yeah, please tell me because it puts them in a place of receiving instead of giving you a wall and saying, why are they coming at me like that? But if you understand that that agreement is there, that it's coming at the person with love, coming to them with love and only try to build them up as a blind spot that they could potentially have because we all have them, then I find that those communication techniques, just being able to offer again, that courageous communication, leaning into it with empathy, having sort of that safe zone of where you can communicate, knowing a good time when it's not the right time to communicate with someone, all of those things make the biggest difference.
Amazing. You got my mind spinning in so many different directions. Do you also offer like one-on-one coaching with practices, or is it mostly on a virtual setting or a case by case workshop setting?
I do both. I do also, and I do offer in practice because sometimes what they want me to do is they want to say, okay, Kelly, not only do I want you to evaluate, the communication, our high performance team habits, because it's not just the individual, because then you move on to the team and the practice. And then who you are, what you do, how you're centered on that core vision, the mission and values, and what your company culture looks like as a result of every individual. So 100%, I do offer that for teams, not just dental, but anywhere in healthcare because people are people. We all have similar, we all have similar issues, no matter where you take it.
And this is a very potent solution that you're bringing to dentistry. I mean, I would say that the majority of practices suffer from this pain point that we're talking about. Do you agree with that?
I do agree with it. And relationships in general. If you think about any relationship that's gone sour in your life, it's usually because one person didn't want to talk to the other about what was bothering them.
Yeah. And of course, your personal life always affects your work performance and vice versa. Few people, I think, are able to kind of shield off their work issues from like the personal side of life.
Absolutely. And so then if you can even communicate that, take it a step further. When you take this to your team, if you're not having your best personal experience day, if you show up and your car won't start, all the things that we go through to get to work in the morning, I believe that one of the most successful things that a practice can do, many will do it sometimes, some will say they do it, but they don't. I know how this is, and it's fine. It's nothing to be ashamed of. It's a growth opportunity. But in these morning huddles that dental offices have, dental teams have, it's an opportunity to say, hey, you guys, I'm not at a 10 today. I am at a solid 7. So the team can say, okay, Kelly, how can we help you? How can we support you in this day? We see that you have a lot here. Do you need a break here? Let's just say that I have a sick child at home. Both men and women experience this, right?
Mm.
As a care provider, wife who partner may be out of town, have a sick child at home, or they're with their mom, or they're with their grandma, or something like that. If I can say that and communicate that to a level of confidence to my team, so they know if I need to break away and say, "Hey, I've got to take this call." Not that it's going to be an everyday experience, but from an area of feeling supportive and feeling supported and feeling like you can live and be a part of a team that truly cares and builds that trust, taking it to that level of team and then how that shows and becomes part of your brand as a practice and what your patients get to experience with that level of communications because they see everything that goes on in that practice.
Yeah, they're like sponges when it comes to seeing
They
how the practice is
do.
operating.
Yeah, I mean, think about it when you go to your doctor's office, I'm looking at baseboards, I'm looking if somebody's upset at me, I'm like, "What is wrong? Did they get lunch today?" I'm you can feel it oozing through the practice.
Absolutely. Where do you see everything being in, let's say, in an ideal world with Next Level and Ascend Health partners?
For me, it's about impacting, yeah, I think I've mentioned this to you before. I want to impact millions and billions of people. I want to have them understand like where they are, what their human potential is. If we break open our limiting mindsets and our limiting beliefs and reverse the lens on that, it sounds like a big lift, but truly it starts with these high performance team habits that we talk about. And if you've ever read the book by James Clear, Atomic Habits, follows a very similar formula. Anything that you want to change in in your life that you want to change, if you want to take a vitamin every day, you got to make it easy. There's certain rules around how you want to make that change. You can take these and apply them to dental teams. So I want to help as many dental practices, professionals, start from the individual level, then go to the team and then the practice to say, how do we serve our why of why we show up every day as our personal mission, value, and how we keep each other accountable to our team, to what we said we're going to do, and also to that personal self. But I think that it comes from an individual opportunity too. This is why people get burnt out because they lose their compass of their north about why did I even go into dentistry because they don't get to answer that question every day through the work that they do, through the team that they're a part of what their why is, and are they being able to serve? Because they get lost in it. And so I think we had a quiet opportunity in the staffing in the industry to probably allow those people to go do other things that did make them happy. So some of the void I personally feel that we're experiencing in the dental industry is from some of those folks that were probably starting to feel like that wasn't serving them anyway. And so how do we bring this to people, bring this content, bring these ideas? That's not new to me. It's not new to Next Level. It's everywhere. But now if we apply, when we apply it to teams and the individual and that high performance individual, how do we make a difference in the world in that way?
Especially making a difference for the practice owner as well to retain their staff because happier staff leads to a longer time that they're going to stick around. I was reading a report in the ADA health policy economic survey. They said a third of dental practices across the country are looking for staff right now. When Cloud Dentistry ran a survey, we figured out that one out of every 13 hygienists that used to have their resume posted is now looking to do something in dentistry more on the business side of things. I see it all. Actually, I see some of them saying they became real estate agents. I think they're identifying their why and they're now intuitively understanding what their why is to bring their happy zone. And that's basically what I've noticed on the cloud side. What do you notice in terms of what's out there from a transitionary perspective? Do you still notice a lot of hygienists that are saying, well, but I'd like to get in the business side of things now, less clinical, or do part time for more balanced lifestyle?
When it comes down, that's a great question because I'm gonna even up level this conversation about what I'm getting ready to say. And because many dentists may be like, well, if they were so interested in business, why didn't they focus on the business of dentistry in my practice? I could hear that argument, right? If they wanted to truly be a business owner, why couldn't they apply it in this way in the practice? I am going to make the statement that every individual on this earth wants autonomy and autonomy, not I'm not talking about applying it to extracting teeth, like, outside your scope. That's not at all what I'm talking about. I'm talking about having feeling like they're in a trusted environment, to feel like they're a part of a decision being made, a part of the team, a part of where the business is going, where it's growing, how they are impacting the decisions with their patients, the care, and being able to also, I think a lot of, well, by looking at the studies too, that the majority of our profession is females. That matters. And I think it doesn't because everything is figure outable. But I think too is that as here we are in time right now, post COVID, people want to be able to have more flexibility.
Yeah.
And dentistry doesn't always offer that. And so what does it look like when an office constructs this to maintain the flexibility? I'm just asking the question. I don't know that I have the answer. But what does it take for the dental office to build the flexibility in for the patients? Because that's who you're there to serve and build in that autonomy for the team members and how they're doing that. And together with those team members, they can come up with that answer.
That's invaluable advice. Your advice is the type where like one takeaway from it can be a game changer for how that practice owner runs his day to day or how that professional that works can adjust being happier instead of stressed out just because it's something that was said the wrong way or processed the wrong way and so on and so forth.
Exactly. And so think about how communication affects all of that. If you felt like you were in an environment where you were supported, what would it look like to say, you know what, on Tuesdays, I really want time to take my children to the doctor, whatever that day is, to do errands, family time stuff, and have that practice owner be like, totally get it, totally acknowledge that, validate you. We're going to see if you guys can swap hours, if we can hire a temp in on these extra days, on this extra time, whatever it looks like to serve the patients. But at least you're getting the dialogue going and you understand. You come in from a different understanding than where you started, because that's where I think we kind of get messed up and misdirected is because we're making assumptions that we think that we are understanding, but that comes from our own. And until we ask, we truly don't know.
We talk about the convenience of time and making that not just offered, but also available. One thing that cloud dentistry has done, which I've never seen in dentistry yet before, is they opened up this fractional unit of time that the job boards couldn't have been able to do before. What I mean by that is a hygienist that has that Friday from 12 to let's say 5 o'clock available after they pick up their young one from school. They can't go post on Indeed and say, I'm going to be available from 12 to 5 on Fridays. They probably won't even post anything on Indeed saying they're available. Instead, with our platform and cloud dentistry, you're able to basically, as a professional, just list that you're available from 12 to 5, what zip codes you're willing to work, and create that work lifestyle balance that you've always wanted to with the scheduling system that's built into the platform.
That's amazing, an amazing innovation because I even also too, even if you've requested your day off from the employer and the date, so let's just say that I take off from work because my child has something going on at school. And then so they just decide to, instead of canceling or, canceling like 2 or 3 hours, they cancel the whole day because they can't find anybody to fill the whole rest of the day. What if I want to still go work? And they've said, no, Kelly, we already have it covered. We've already blocked off your schedule. We're not going to spend the extra manpower to call these people back. It works in every way. And you're exactly right. And when I was temping, I wish that was available because I needed those fractional pieces of time because I was paying off college loans. I was trying to find those excerpts where I wasn't maybe available for a whole day, but I really wanted to work and contribute.
And even from a practice owner standpoint, when you talk about like offering a convenience and flexibility to the patient, whether it's a new patient or an existing patient, or even a recall that you're trying to bring in, having access to that fractional unit of time, it really helps to be able to deliver that flexibility to the patient.
100%. Yeah. I wish more people knew about that asset that you all have there. That's a nugget of gold for many of us.
Yeah, hopefully we'll reach a network effect and the whole country will end up using cloud as to connect.
That's right.
How could people get in touch with you, by the way, if they wanted to reach out to you?
Sure. Thanks for the question. You can always go on nextleveldentalhygiene.com. Also, Next Level DH. It's that contact for both Instagram and Facebook. And then there's always an email on the website that you could reach out. You can also join our newsletter. We also have a podcast called The Dental Handoff, and it's all about interviewing team members, dental professionals about how to improve dental communication, their nuggets, their lessons in life, and their valuable input on how they've overcome different obstacles throughout their career. So it's pretty cool.
This is all fantastic. I've been in dentistry for over 25 years now, and it's rare to meet coaches, if I may, brand you as one that is so capable of delivering information to a practice owner or a professional in a way that would have like an overnight change on their lifestyle and their career.
Thank you for that compliment. It truly is. It's just you shift your mind and you think about what you believe about something. I'm oversimplifying it, right? But it's a muscle that you have to flex to practice it. But it's what do I believe and what's truly the opposite of that? Because instead of being in a fear-based mindset, if you were in a abundance mindset, what would that look like? And then just make the decisions and take the actions towards that every day as an individual and your team, and people notice it.
Yeah. Do you speak to many schools out there, like from, let's say, the graduating classes that are just going into the workforce to understand the dynamics of what to expect out there?
I do. I do it every year. I speak to the Oregon Dental Hygienists Association, their student association. I'm very active in Virginia, where I'm from, with the Virginia Dental Hygienists Association. I've had the privilege of speaking to students across, well, internationally, truly, but about what to expect, what their opportunities are there, because there's so many ways that they can impact now with all the technology, change them being that change that they want to see as well. And saying, here's what we're learning. Here's the litmus test on what's passing, the litmus test, and how they can come into that work environment and make a difference. Because I tell them, I say, listen, the first job that you have may not be your forever job. It's a stepping stone for you. It's an opportunity for you to grow and learn things about yourself, to skill up. And they're probably going to learn something too.
Ladies and gentlemen, Dr. Kelly Tanner, honestly, I look at you as such an icon in dentistry. I really enjoyed our time together today.
Well, thank you so much. It's an honor to be here with you. And I love and appreciate everything the cloud is doing. Also, Peer Dental with coming up with solutions that are very different than what we've ever had before, because it's truly not just a job board. It's interactive. You have control over what it is that you're doing through your own scheduling. So I appreciate what you're doing for the profession.
Thank you so much. Thank you so much. The pleasure is all ours. And we look forward to collaborating with you more in the future.
Okay. Thank you so much.